So any questions? We have a few minutes for questions.
Are you aware that in Italy they passed a law that only a physician may use a medical device, and this is being proposed in Europe?
I'm not aware about. There are lots of different issues in terms of who can use devices and who can't. They vary state to state. I wasn't aware that they had passed that in Italy. That's obviously a sensitive issue in a multidisciplinary society such as ASLMS. It really varies across the country, and depending on the jurisdiction, there are laws such as that. And then there are places like Massachusetts where I am, there are no laws whatsoever, so anyone can do it.
I have a few questions, so bear with me. First one, what's your standard of recommendation for hypopigmentation? I know you mentioned bimatoprost, but I don't think we really went into what the actual recommendation was.
The question was about hypopigmentation. So first, it's seen more commonly after heavier procedures, specifically full field ablative. Second, I think that the incidence of it is much less with erbium than CO2 when you're using full field, simply because you have an endpoint to recognize with pinpoint bleeding. There are a few people like Susie Kilmer and Vic Ross who I do believe they see the tissue contraction as an endpoint, but that comes with 20 years of experience and being as smart as them, and I'm not, so I use pinpoint bleeding. But when you do see it in front of you, many of the studies have tried to look at this, and it's very hard to do a controlled study because these circumstances are different, patient types are different, and the degree of hypopigmentation and skin type. So what has been helpful is, first of all, non-ablative fractional lasers seem to be helpful and seem to be my go-to for this. But secondly, there are some particular case reports looking at bimatoprost along with fractional lasers. There was one by Misaki that was published in Dermatologic Surgery, and then one Jill Weibel did in Journal of Drugs and Dermatology. But there was a presentation yesterday that showed that bimatoprost did not make a significant difference, and it was probably more likely the laser itself. So I think it would be reasonable to start with non-ablative fractionals, explain to the patient that even though a laser seemed to cause this condition, a laser and a different type of laser may actually make it better. And I certainly don't think it hurts to try to drizzle some bimatoprost over the area.
Awesome, thank you.
One other thing I'd say with hypopigmentation, and I'll steal a little thunder from my talk tomorrow morning, sometimes time. I've seen hypopigmentation from striping from IPL, and I ask the patient to come back in 6 or 9 months, and it's completely gone.
And another thing that I use is pimecrolimus, Elidel.
Okay.
I find it very helpful. Pimecrolimus, it's
It's Elidel,
calcium,
yeah.
Elidel.
Yeah.
Elidel, yeah.
Perfect, thank you.
With 1927 thulium lasers, either or, combination or alone.
Great, thank you for that. I've had patients ask me about treating over cosmetic tattoos when they no longer want them anymore. Is there a potential for those tattoos to actually darken or look worse after treating over them with energy-based devices?
Definitely there is a big chance that they will darken. So that always do a very small test spot on the side, which is not very seen much, maybe the corner of the mouth.
Sure.
And if it darkens,
Stop,
tell
obviously.
the patient. They might get better because the color will be black. It will be more amenable to laser therapy, but it's a discussion that you have to make with the patient.
Okay, and then last one, just a legal matter. So I am a physician assistant, I'm a non-physician extender. I run the training program at my MediSpa, and I try to make sure that everybody is as up to snuff as possible. One problem I've had with my boss is that I don't want my name necessarily on those. Am I also held liable if something goes wrong with those nurses that are working underneath of him? And
You mean, so you train them, they go and they see patients and they have a problem?
yes,
Well, I mean, you're an employer. They wouldn't go after you personally for training, but they would go after the business. I mean, they can't go after your home because you didn't add,
just because I'm
assuming you're an
employed.
employee. Now, if you own it, they'll go after you as an owner, and that'll be part of it. But
Sure.
if you're an employee and you're providing training, that would be more against the business than would it be against you.
Perfect. Thank you very much.
Hi, it's a question for Dr. Avram. One of the things that I'm very keen on is the idea of request for treatment. The concept of consent is often considered very passive, and particularly for complex patients or conditions, and the variability of outcomes, which are often subjective. I like to have patients actually request treatment. Is this a commonly known idea? I've not heard of it mentioned at this conference before.
Well, I mean, that's the way of practice too. I don't go out of my way to suggest to patients what they should be doing. I want it to come from them. First of all, I think that's a good idea. I learned earlier in my career, when we had fewer lasers, I'd try and do things I thought might help, and sometimes the patients felt like I was doing something that they didn't really come for. That's definitely not valid consent. Your relationship with your patient is the most important way to prevent any kind of legal action. So to the extent that you are doing what they asked to do, you're going to have fewer problems, period. But in terms of the consent itself, as long as they sign it and it's a valid consent, there's a rebuttable presumption that it's a valid consent and they consented to what they're doing, and you don't need to worry about, well, I didn't really want to do it, but then the doctor, I'm sorry, whoever's treating me convinced me to do it. If you have the actual evidence that they signed the consent, it's a valid consent.
Yeah, I feel that request for treatment is more interactive, so we'll often get people before consultation to say, this is what I'm looking for, and, for example, they come for resurfacing for acne scarring. They'll often say, I want 100% improvement. Use that as a discussion point, and we'll, sometimes if we get a worrying feeling about the patient, say, look, I want you to fill out another one of these so that they can reflect back what your reasonable expectations from the outcome would be of the treatment, basically.
Right. Not only do I agree with that, but we do the consent every time the patient comes for a procedure.
Yep.
So I saw a patient, it was their 43rd time they got botulinum toxin with me. They've had a consent every time they come in. It's the same with the fractionated laser procedure, which is multiple procedures. So we always do it because the whole idea is that they understand the risks and benefits. You've gone over it.
Yeah.
The other reason with this is a little bit different, but there are seasons, and your risk for certain adverse outcomes change at different times of the year. So I think it's always good to have that conversation, like you said. The conversation is the most important part. The documentation is the legal part.
Yeah.
So they're two different things. What you're talking about is good practice of helping the patient.
Yeah.
What I'm talking about, the consent, is protecting you legally.
Yeah, my feeling though is that if you've got the patient's own words in that they understand stuff, it feels to me that it's more powerful rather than the passivity of I consent. But,
Right.
But thank you for your thoughts.
Absolutely.
Thank you.
I think one last question. Go ahead.
Good morning. Hopefully it's going to be a quick one. How often do you resign the consent if they're coming in for the same treatment?
Yeah, so I'll tell you what we do, I just mentioned this, each time they get the procedure. Now, if we forget for that, if they don't sign it one of the times, and let's say we're doing 5 fractional procedures and miss it once, still pretty good evidence. It's going to be hard for someone to say didn't consent to them doing this. So the initial one's the most important. We do it each time. That way there is no ambiguity as to, it's more paperwork, it's 30 seconds more, but it's the best evidence that they understand what's getting done and they want to go forward with it.
Well, what I do in my office is when they come in, if it's a series of treatments, in my consent, it's almost like a patient contract that they have consented to 4 procedures that will be done 1 month apart. And for the consent is valid for the duration of treatment. Is that okay?
I mean, that's fine. What if they come back a year later?
So if they come a year later, then if it's a new year, we just have them re-sign the consents.
Yeah, I mean, it's better to have more documentation than less, but I wouldn't say that's inadequate. I think that's fine, but I'd rather bend over backwards for lots of reasons. If a patient complains, things don't always end up in lawsuits.
Yes.
You can say, we've gone over these risks and benefits 5 times already. You've signed this consent form 5 times. you know, you're having an issue, oh, I'm more swollen or whatever. We've discussed this. You know, I think it's good to have that documentation.
And just question for regarding hypopigmentation from tattoo. Is that considered really a complication, or that's sort of like an expected or potential outcome that the patient needs to be aware of and agree before the procedure is done?
I mean, definitely the patient should be aware of all the side effects that can happen, but it should not be something that will happen all the time. It is an adverse event, in my opinion, the hyperpigmentation. So try to avoid it by using the proper setting and avoid damp patients and all that.
Thank you.
All right. I think there's another session coming up, so thank you all very much for waking up early and joining the session on complications, and thank you to our faculty very much. We are concluding the session.
Thank you so much.